Years old man has been admitted after being knocked off his bicycle. His ankle is grossly deformed with bilateral malleolar tenderness, with severe ankle swelling and tenting the medial soft tissue. What is the most initial management? So in this scenario, the joint is grossly deformed, bilateral malleolar tenderness, ankle swelling, medial soft tissue involvement. In this condition, that means a gross deformity. In case of gross deformity, the definitive treatment is the surgical fixation. But here we can see what is the initial management. The options are application of compression dressing and physiotherapy, application of external fixator device, immediate reduction and application of the back slap, surgical fixation, application of full leg plaster cast. So let's see, this type of injury, that means is a grossly deformed injury. So what is it? This is unstable ankle injury. That means no stability of the joint. And in case of unstable injury, in case of any type of the unstable injury, the definitive treatment is this surgical fixation. So it is the definitive management. The definitive management usually this surgical management in case of any type of the ankle injury. But in this question, they want to know about the most initial management. Here the immediate management of the displaced ankle fracture is to reduce the fracture and prevent soft tissue compromisation. So immediately we should reduce the fracture and a plaster which is not full plaster. That means we should give the half plaster, half circle fracture, half circle plaster. Why we should give plaster? Because the unstable joint, if we give more time in unstable form, in this condition there is the compromisation of the soft tissue and damage of the soft tissue such as the muscle ligament, blood vessel, nerve tissue. For this condition we should immediately reduce the fracture by the back slap, and it can be performed even before an X-ray do. So always not wait for the X-ray. In case of grossly deformed joint or grossly deformed injuries, first of all do an reduction and back slap, and then go for the X-ray. So it is the most initial management. It is not the definitive management. Definitive management for any type of the unstable injury, go for the surgical fixation. So what is the most initial management in case of grossly deformed fracture? First of all, we should go for immediate reduction, then application of the back slap. Other option here, such as the application of compression dressing and physiotherapy, it should not be done, because in the compression dressing and physiotherapy, the lesion will be aggravated. And application of the external fixator device used in case of the open fracture and some case of the closed fracture also. And surgical fixation is the definitive management, and it requires the different type of the instrument and experienced surgeon. But before this we should go for the immediate reduction and application of the back slap. But this surgical fixation is another option, which is the definitive management, not the initial management. And application of the full leg plaster cast. Full leg plaster cast should not be given, because here there is the bone fracture and displaced fracture, so it will develop more edema, more swelling. So when we will give the full plaster, it will not be possible to expand the swelling. For this condition, compartment syndrome also may develop. So never go for the full plaster, always give the half plaster in case of the acute injury. When there is a chance of swelling or edema in this condition, first of all we should go for the half leg plaster cast, or there is back slap.